So, welcome to this new CME. In the uh, routine CMEs, whatever CMEs we take, our purpose is to apprise students of newer points. Most of the times, the topics may not have been covered during our routine training sessions, but on so many occasions, the topics have been covered and we want to lay out certain important extra points, and that is a purpose. For example, Vasa previa. We have already covered this point, but there are certain other finer things which have to be taken into account. So let us go on from the beginning. Now, what is Vasa previa? Vasa previa is presence of vessels over the internal os, fetal vessels. First point is this, which you should know: fetal vessels. And what are the fetal vessels? Umbilical artery and umbilical vein. These are the fetal vessels. So if they overlie over the internal os, we'll say it is Vasa previa. Now, they may not be exactly over the internal os, and even if they are within 2 centimeter of the internal os, we consider it as Vasa previa. A very important point which has to be kept in mind is umbilical cord over the internal os is not Vasa previa. If vessels are within the umbilical cord, they are protected by the Wharton's jelly. But when the vessels are over the internal os, lying between the membranes, and what are the membranes? Which are tightly attached over the walls of the uterus here, going over the internal os as well as in the surroundings. The membranes are chorion and amnion, which are tightly attached to the walls of the uterus. And if vessels are running within these membranes, what will happen? Close to the tongue, there is dilatation of the cervix. So this area close to the internal os is also going to dilate, and stretching of the membranes, breaking up of the membranes will lead to the breaking of the vessels also. So there will be torrential hemorrhage, and that is a very important cause of perinatal morbidity and mortality. So we have to be very careful about this. Now, one of the very important basic thing is that see the umbilical cord, if it is attached over the placenta and you don't find any accessory lobe, subaccentuate lobe or bilobe placenta, then chances of Vasa previa are less. We have to also see for any low-lying placenta, because what may happen many times, placenta may be low-lying and the umbilical cord may not be directly attaching to the placenta. It may attach somewhere here, for example, and then the vessels, they move out of the cord and traverse this area, finally reaching the placenta. So that is velamentous insertion. That can also be associated with Vasa previa. So the basic thing which you have to see is, number one, when you're doing a routine scan, see that the umbilical cord is attached to the placenta. There are no accessory lobes and there is no velamentous insertion. Now, if you are able to see that none of these risk factors are there, you are pretty safe, but still you have to be careful. There's a saying that whenever you see the cervix, for example, you want to assess the cervical length in the second trimester or even later on, always see whether vessels are there over the internal os or not. And vessels means fetal vessels. And in fetal vessels, the best vessel which you have to see is umbilical artery, and put Doppler and see whether the pattern is like umbilical artery. It should not be uterine artery flow. Be careful. Okay. So first use color to see vessels there, and then put spectral area to see what type of a spectrum is there, and the spectrum should be of umbilical artery type. Now, A lot of cases you'll be able to pick up, because what we do a longitudinal scan, and in the longitudinal scan we can see majority of times vessels in full length crossing the internal os, and we are quite clear about the diagnosis. But many times what may happen, the vessels may not be running sagitally, longitudinally you may not be able to see, and they may be close to the internal os in the danger zone, which is roughly 2 centimeter from the internal os. So over the internal os and within 2 centimeter of the internal os is a danger zone, and here you may find these vessels just like dots. You put color and you can see flow in these vessels. So when they are running transversely and they are just like dots here, you may miss out. You may see easily when they are in length, full length, but when they are in transverse section in short axis, you may miss out. But putting color and then using Doppler to see the spectrum and confirming that this is an umbilical artery waveform, you can be very confident about picking up. Now 2 centimeter, I have told you, within 2 centimeter of the internal os, this is the routine, and most of the times you will be able to pick up cases of Vasa previa if you adhere to this. But many times they may be up to 5 centimeter or so. So 2 to 5 centimeter is a borderline area where you have to be careful. The reason is when the cervix dilates, it may dilate up to about 10 centimeter or so, which means up to 5 centimeter of the lower segment here may also dilate along with the cervix here. So roughly around 5 centimeter from the internal os, try to see, and you may not label between 2 and 5 as Vasa previa, but still you can caution that this is a risk and it can be as dangerous as Vasa previa. Now see certain uncommon conditions which may happen and they can be avoidable. One condition is, like in this case, the placenta was there, which was a single lobe, there was no accessory lobe, there was no velamentous insertion of the cord, and the cord was inserting normally into the placenta, but we had the vessels reaching from one edge of the placenta to the other edge and within the membranes crossing the internal os, and this was a case of Vasa previa. So this could have been missed, but it was not missed because of the habit of putting color over the internal os and looking for any fetal vessels. So this is the trick. You want to pick up all cases, use this. See the area around the internal os within 2 centimeters and over the internal os, and see that there are no fetal vessels which are within the membranes. They should be tightly attached. They should not be loosely lying as an umbilical cord. So that's it. Thank you.